Are you experiencing pain in the penis and also feeling a hard nodule in the penis? So then it's probably Peyronie's disease. Myself, Dr. Pramod Krishnappa, Andrologist from Bangalore. So Peyronie's disease is an abnormal scar formation inside the penis, because of which two things may happen. One is the bending of the penis. Second is the poor erections, which we call erectile dysfunction. So we decide how much is the curvature or how much is the bending. If it is more than 30 degrees, that is when we usually suggest a corrective procedure. And also for the erection, we do prescribe medicines which will improve the blood supply to the penis so that the erections are better and the patient will continue to have a satisfactory sexual intercourse. So there are two phases of Peyronie's disease: acute phase and the chronic phase. Acute phase is the first initial phase, which may last from 6 months to 18 months, and during which a person will experience pain and the plaque or the scar may start appearing in this phase, and also the bending of the penis, or what we call as a curvature, may start appearing in this phase. And there are not many options to treat at this phase. Usually we prescribe medicines to improve the blood supply to the penis so that the healing happens better, and we prescribe some pain medications which a person can take it intermittently. So that is what is done in the acute phase. The chronic phase is when this disease stabilizes, and that is when we plan the interventions depending on the degree of the bending and also the extent of the erectile dysfunction problem. So in the chronic phase, again, there are many options such as penile traction therapy, there are collagenase injections, and there are surgical procedures like plication, plaque incision grafting, and penile prosthesis. The collagenase injections is out of reach of many patients in India because it is available only in the United States at the moment. This is in 2024 March, currently not available in India. Penile traction therapy, yes, one has to wear it for nearly 4 to 6 hours a day and for nearly around 3 to 6 months. Surgical options, plication is where we put the stitch on the opposite side of the bend to correct the penis. Plaque incision grafting is if the curvature is more than 60 degree, we incise that scar and then make the penis straight, and then in that raw area we put an additional synthetic graft so that the raw area is covered. And if the person is not responding to any of these erection medications, then we also do a simultaneous penile implant surgery. So this is in brief how we address the Peyronie's disease. Of course, it's always better that he be examined by the doctor so that he will be able to assess to what extent or to what degree is this Peyronie's disease and how stable is the disease for us to proceed with the other interventions. And Peyronie's disease is not a sexually transmitted disease. It is very commonly seen in diabetic patients.